Hey everyone, it's Jeff. I hope you're doing well. This is part 1 of 2 videos for my entire in-person consultation with Dr. Chen for bottom surgery, and please know that I did get permission from him to film this, so hopefully this helps.
Sure.
If that's okay, yeah.
Totally fine.
Okay.
Totally fine.
Yeah, and I just wanted to get your okay on that too. That's important to me.
I appreciate the heads up.
Okay, you were going to maybe ask another question, I'm so
Yeah,
sorry.
you're right-handed.
Yep.
You never had an injury to your left or right arm?
No.
Okay, no cuts, no broken bones, nothing
Nope,
like that?
nothing. The only somewhat break that I've had was a sprained ankle on my left, but we're all
Gotcha.
good.
What surgeries have you had so far?
I've had hysterectomy, top surgery. I had an eyelid lift.
Mm-hmm.
I don't know what the specific terminology of that
No
was.
problem.
It was a while ago.
That works for me.
Yeah.
Any medical problems? Diabetes, high blood pressure, anything like that?
Just in my family, my dad had diabetes type 2 and passed away from pancreatic cancer, so there was some issue with that as well.
I'm sorry to hear that.
It's okay. It's been a while, so I'm at least used to it. But yeah.
Are you taking any other medications other than testosterone?
Just testosterone.
Okay. Any medication allergies?
No, not that I've found or am aware of.
And how important is it for you to stand to urinate?
Very important.
Okay. And eventually penetrating with intercourse?
Yep.
Also very important?
Also very important, yeah. Sorry.
And what's your ideal goal, length? Would it be...
5.5 length, 5.5 girth, if it's possible for that.
Okay. Do you use any nicotine products, smoke at all?
No.
Any family history or personal history of bleeding, easy bruising, blood clots?
Not that I am aware of, no.
Okay. All right. So, you'd be interested in urethral lengthening, it sounds like?
Yes.
Vaginectomy?
Yep.
Scrotoplasty? So the whole thing?
Pretty much, yeah.
That's the most common one.
Yep.
I do this surgery with a plastic surgery team.
Okay.
It takes 3 surgeons. There's me and then 2 other plastic surgeons.
Mm-hmm.
It takes about 8 hours.
Okay.
They're operating on the arm,
Mm-hmm.
making the phallus, making the urethra from the arm, while I'm doing the vaginectomy, the scrotoplasty, the urethral lengthening, and then the nerve dissection.
Okay.
By the time I'm done with that part, they're done with their part, and we get together and we hook up the urethra, the nerves, the artery, and the vein.
Okay.
Then we close the skin. That process takes about 8 hours.
Okay.
In order to make sure the urethra heals properly, we put a tube called a suprapubic tube in,
Okay.
and also leave a urethral catheter that goes through the phallus itself and inside the urethra. So there's those 2 tubes in. You're in the hospital for 5 days. The first 2 days, you're in the ICU. We check on your phallus like every hour. You won't sleep much.
That's totally fine.
Yeah, it's important because
Right.
we want to make sure you still get continuous blood flow to the phallus. After 2 days, our sphincter tone, our worry level drops, and so we check it less often. You get more rest. You start feeling better, and then by day 5, you're walking, and if you walk okay, we send you home.
Okay.
The complications of surgery are a lot. There's a lot of them, about 50% or higher.
Okay.
Okay, even with a forearm.
Okay.
The reason is there's so many moving parts, so many incision lines. Most of the complications tend to be small, like a wound opening, a wound infection, things like that can happen. If those happen, usually not surgical, antibiotics or just keeping things clean,
Okay.
it'll heal on its own. The more common, more longer lasting complications are from the urethra.
Okay.
It's stricture and fistula.
Yep. Can you describe those
Absolutely.
a little more? Yeah.
Stricture is a narrowing. So it's trying to push urine through a coffee straw. It's
Okay.
hard to do.
Yeah.
You get a weak stream. You feel like you have to push pretty hard to urinate. You feel like you can't empty your bladder all the way. And you also feel like it takes forever to get the urine out. That's a stricture.
Okay.
It usually presents itself about 3 to 12 months after surgery.
Okay.
It doesn't usually happen right away. It takes time.
Okay.
And it happens just due from scarring. It starts to narrow like this.
Okay.
A fistula is an abnormal connection between inside the urethra and the outside skin. So if things don't heal properly or they need more time to heal, there will be an opening. So when you urinate, urine comes out not just the tip of the phallus, but somewhere else.
Okay.
Okay? If it comes out somewhere else, that's by definition a fistula.
Okay.
If it's a small volume and it's a small opening, usually those heal, no big deal. But sometimes they don't. If they don't heal by 3 months, it usually requires surgery to fix it.
Okay.
We jumped ahead a little bit, so those are the complications.
Yeah.
The other complications are from the hand. You can get hand swelling. It happens almost to everyone, but it usually goes away. On rare occasion, I know of 2 patients where the hand swelling persisted.
Okay.
And that's not pleasant. You have to wear
compression sleeve.
Exactly right. Exactly right. And most of the times, the skin graft takes pretty well, but sometimes it takes longer to heal because of blisters or parts of the skin graft that didn't take on the underlying muscle. Okay.
Have you had a lot of issues with the stitches not coming out or having? I don't know if that makes any sense.
We do sometimes see metal clips that are under the skin graft that eventually spit themselves out or pop out.
Okay.
Or you actually have to pull
Remove
them out.
them.
That happens on occasion.
Okay.
That happens when the surgical clip goes on a small blood vessel. Eventually, the small blood vessel scars down, and the clip is no longer holding on, and it can eventually, your body will just push it out, or if you see it underneath the skin, we can pluck it out.
Right. Okay.
That's what that is.
Okay.
The stitches are all absorbable, meaning they just dissolve. We don't have to take those out.
Okay. And it's not like a glue type that most of the hysterectomy type.
Right. It's not a glue. It's actual
it's
suture.
An actual. Okay.
It's actual suture.
Okay.
The earlier you start using your hand, the faster your hand will recover. Most guys, probably by 3 months, have full function of their hand back.
Okay.
By 1 month, usually most of their function back.
Okay.
But it's in general, it's 1 week. You start moving your hands, your fingers.
Can you do anything before the 1 week mark? Like, is it
5 days is kind of the earliest point, but we have to look at your graft first to make sure it's healing well. And then, so you do your hand exercises the first week. Second week is wrist exercises combined with hand, and after that, it's kind of using it as much as you can.
Okay.
The earlier you use it, the more often you use it, the faster it'll return to full function.
Okay.
Other complications. So for the flap, it's losing blood flow to the flap. That would be devastating. That happened maybe in 1 out of every 150 patients where they get a blood clot.
Okay.
It can happen because of a genetic predisposition, which is why I was asking you about the bleeding and blood clots. It can also happen because of positioning the phallus the wrong way. We tell you in detail how to position the phallus to avoid that from happening. You basically don't want the blood vessel to kink or to get compressed.
Right.
That can lead to a blood clot.
Okay.
So those are complications of the surgery. So after the surgery is done, we see you about once a week. Make sure things are healing okay.
Okay.
At the first or second visit, depending on how you heal, we take the urethral catheter out. And then by the 3rd visit, as long as you're healing well, we have you start urinating a little bit before then. And if you urinate okay, we take out the suprapubic tube at the 3rd visit. Okay. And then the 4th visit is kind of like a final checkup, make sure everything else is healing okay. We talked about wound openings. The most common location is between the phallus and the scrotum, and behind the scrotum, where it connects to the area called the perineum. Those areas are under tension, and so when you start walking, it can create tension and start to pull wounds open a little bit. Okay. But you kind of have to walk. If you don't walk, you're going to get blood clots in your legs. Right. Your lungs won't expand. Your bowels will fall asleep and you get constipated. So it's important to walk, but we do tell the patients to take it easy. Be careful when you get up and out of the chair. You don't want to put too much strain on an area that's already under a lot of tension.
Right. Especially because that area is not used to the weight and gravity takes that.
That plus there's postoperative swelling. So swelling puts tension on the wound, and then when you walk, and you're doing this, it puts tension right there. Right. So that's the reason why a lot of these can happen. Okay. We've tried changing sutures. Same result. Okay. So it's not because the sutures are dissolving too quickly. It's usually because there's a lot of tension there.
Have you ever had someone who heals too quickly that there's an issue with that?
Sometimes. Now that question I can answer it several ways. If it heals too quickly and strongly and it does this, then you could potentially be at risk for a stricture. That's the main downside of that. Yep. Okay. That's the main downside of, I guess, healing too quickly or healing where it just scars down.
Are you able to tell kind of, I don't know how to phrase this question, because you can't really guess if there are going to be complications down the road, like...
young, healthy guys with no hypertension, no high blood pressure, no diabetes, things like that, tend to do better than older patients with medical problems.
Okay. Yeah.
In general.
Okay.
Thin guys tend to do better than heavier set guys.
Mm-hmm.
There's less tissue to cross, better blood flow.
Mm-hmm.
That's the reason. I think that's about all I got for that answer.
Okay.
Yeah.
So I do have a forearm tattoo.
That'll be in your urethra.
Okay, so it won't necessarily show.
Yeah,
on the
if
outside.
anything, you might have like the top of the B, F, and I, and maybe L on your phallus, but most of this is urethra.
Okay, and then would it probably be cut up maybe around
there?
the
Usually
two?
about 60% of your arm, so like 5.5.
Okay.
Because you're thin, it'd be hard to get 5.5 in girth.
Okay.
Okay, but I think length 5 is reasonable. 5.5 might be a little difficult, but I think 5 is
A reasonable
goal. And let me check while you have your arm out.
Yep.
Let's have you turn it around. Make a tight fist for me. All right, and then make an open palm. Okay, pinked up nicely. I want to do that again. Tight fist.
Okay.
Open palm. Okay, so that means there are two arteries that come down here, the ulnar and the radial. This is the one we take to supply blood to this flap. The radial artery is kind of in the center of the flap. That's what you want.
Okay.
And then once we take that, we stop here and we make a cut all the way up here to get the blood vessel leash that will reach the groin. This artery is then preserved to supply the rest of the blood to your hand.
Okay.
Okay, and you're a candidate because you had a good Allen's test.
Okay.
You are also, because you're thin, there's about a 50-50 chance that we may not be able to put a glands on at the same time.
Okay.
The underlying fat from the forearm skin is kind of what we rely on to provide extra blood to the remainder of the flap. When we do a glands, we have to make a full thickness cut in the skin and then roll it up to give it that ridge, which means there's nothing but fat behind it. If the fat's thin, you can imagine doing that could potentially damage the blood flow to this much.
Okay.
And you would lose an inch of your phallus. That would be awful.
Yeah.
So there's a chance that when we do it with the plastic surgeons,
and you wouldn't really know necessarily until you're already until I'm under.
Right. I've seen thin guys like you get a glands and are okay. I've seen a thin guy like you not get a glands because it was just too thin.
Okay.
It just depends on what the anatomy is once we cut the flap free.
So realistically,
50-50.
Yeah, I probably wouldn't be getting everything done in one stage.
What it would be vaginectomy, scrotoplasty, urethral lengthening, phalloplasty, plus or minus a glands.
Okay. And then, is it 6 months later the glands can?
Glands we can wait. We can do 3 months.
Okay.
At 3 months, so as we talked about, it was just the radial artery to begin with. But as time passes, and your phallus is now on your pubic area, new blood vessels are growing in basically from everywhere. So much so that if you actually cut the original radial artery, there's a chance that your phallus may still be fine because there's new blood flow from everywhere.
Okay.
That's the type of environment we want to do.
The
cuts on the cuts on the phallus.
Okay. In case of an issue of a urinary tract infection or bladder infection, what would be your protocol with that? If there's a catheter and things like that.
With a catheter in place, there's a high chance of getting an infection.
Okay.
My guess is like 10 to 20% for a UTI.
Okay.
Getting a UTI. The way we avoid that or minimize it is basically to try to get the catheters out as soon as we can, and to give you prophylactic antibiotics while you're in the hospital and also afterwards.
Okay.
That's how you avoid it or minimize a UTI. You have 2 catheters. Whenever I take out a catheter, I try to give an antibiotic around the time of catheter removal to decrease that risk. Because every time you manipulate a catheter, manipulate a catheter, like take it out or put one in, there's an increased risk of an infection like by 1 or 2%.
Okay.
So that's when we give you an antibiotic. We give you about 10 days worth as a just in case. So let's say you have a catheter in and you notice your urine starting to look cloudy and smell worse. That chances are it's an infection. In which case it's not a day's worth, it's actually a week's worth now.
Okay.
So we give you that 10 days to allow us to tailor it depending on what your symptoms are.
Okay. And this is where part 1 ends, so you can click up here in the cards for part 2 and the continuation of my consultation.